All right, so this is Rex. Rex, it belongs to actually one of our coworkers down in boarding, and he's about 6 months old, and so we're gonna neuter him today. So we're gonna do a quick little pre-anesthetic exam on him first, make sure he looks good for anesthesia, and then we're gonna give him some pain medicine and kind of get him ready for everything we're about to do to him. So he's obviously very excited about this. It's all right, bud, but we're gonna look at him, make sure all of his baby teeth fell out just like they were supposed to, and they did. You got some good teeth, bud. And then we're gonna listen to him, make sure his heart sounds good. And his mama did some lab work on him, which we like to do before we put him under anesthesia to make sure they look healthy, and thankfully it looked great. His purr box works very well too. Hey, bud, can I listen to your heart? I just hear your purr box. It's weird, but sometimes if you blow in their face, it'll actually make them quit purring for a little bit, but he's pretty determined to purr. All right, bud, you want to face the camera for a minute? We're going to feel on your belly and look at your back end. Said I have a lot to say about this, you guys. Yep, everything looks great. I'm going to take his little Band-Aid off because that's where we got some blood on him. So he looks great. So what we'll do first is we got some pain medicine we're going to give him and a little mild sedative. That's just going to kind of get him relaxed before the procedure and make sure we have good pain control. Thankfully, a cat neuter is one of the more simple procedures that we do, but it is still an anesthetic procedure, so we still do everything just like we normally would, but it's just going to be pretty quick. After anesthesia and prepping the patient, we take a scalpel blade and make a small incision into the scrotum in order to exteriorize the testicle. And once it's exteriorized, we take some gauze and help just get some of the extra tissue off of it to expose the spermatic cord. We don't place any sutures in this procedure. We actually tie the spermatic cord on itself with some hemostats. And once we have done that, we take the scalpel and remove the testicle. We check for any bleeding, and if everything looks great, we repeat the process for the other testicle. Once the surgery is completed, we actually leave the incisions to heal open by second intention. Since the incisions are so small, they don't require any sutures.